Smash the button. Brother, this is an honor and privilege, mate.
Hey, how you doing today? Nice to meet you finally after all our emails back and forth.
Yeah, it's okay. Like, life happens. We have to change and adapt and flow like the river a little bit. That's all right, But I remember a good friend of mine said, stay curious, right? So that's usually what I try and keep in the forefront of my mind every day is a bit of curiosity and asking why. And then, dude, I don't know how, but he came up on my Instagram. I was like, this looks like cool shit. Super curious. What do you do? Why do you do it? How do you get into it? The whys. Let's dive straight in.
Yeah, good questions. I'm not entirely sure I know what the answers are to all of them, but I'll give it a shot. So well, I suppose really in its purest form, I'm a healthcare manager. Really, is what I do, and a businessman. I run a company called the Beekeeper, and we're a regional mental health organization in Southeast Asia, which really was given birth to just around 4 years ago. We started, and the company itself was born in upon itself out of tragedy. So I used to work for people like Save the Children, the United Nations, UNICEF in particular, specifically working around family services, child protection, welfare, etc. And I was working on a program in Cambodia where I live, and we we had a weekend retreat, and I wasn't on the particular retreat itself. And very tragically, there was an accident, and four of my colleagues were killed in that accident. And it was a life-changing moment. I think, when you try and articulate and understand what does a life-changing moment mean, I would probably say it was that point that I realized what life-changing really, really meant. Like the very substructure of your existence shifts and changes. And my team was quite large, and there were many involved in the accident, and we had to triage the accident because there aren't the kind of medical infrastructure isn't in place in Cambodia to be able to respond to an accident like that. And as a result, I knew due to my mental health training that we had a storm coming in the form of kind of post-traumatic stress disorder amongst my friends and my colleagues. And sure enough, it did come. And in Cambodia, we didn't have the facilities or the capability to respond to that particular kind of clinical requirement. So I decided to set up a company called the Beekeeper, and we are founded on Buddhist principles or precepts of Buddhism. And we are a mental health organization which combines what we see as both ancient but also contemporary somatic approaches. So when I say somatic, I'm talking about working with the body and kind of classical contemporary psychological talk therapy approaches, which would be your kind of your counseling skills, because we because we're situated in Southeast Asia, we're surrounded by Buddhism. We're surrounded by people utilizing qigong, tai chi, yoga. Those sorts of practices are part of everyone's everyday life, and you can really see the efficacy and the impact they have on individuals in terms of their response to things like trauma. So it really got me as a psychologist. It got me really sort of fascinated by that. How could I help respond to the accident? Um, but more broadly, how could I develop a practice and an outpatient treatment service, and now subsequently an inpatient treatment service, which we have as well, that takes into consideration all the different skills that we've known about for thousands of years, and build those into a contemporary psychological practice and see if we can make that fly. So, one of the kind of slogans I use is kind of meditate, don't medicate,
Mm.
which is it's not that we're opposed to psychopharmacological approaches, but we really encourage people to engage in it, and that subsequently has led to me, doing more research into the area of how these Eastern philosophical approaches can really inform contemporary medicine in many ways. It's a very
Wow.
long-winded answer.
No, dude, that's beautiful, you know, and I appreciate the honesty and opening up about the story and the origin story, right? And I think it's important because it shows humble beginnings, you know, and it's birthed out of life at the end of the day, you know. And I think going about it with this double prong approach of okay, cool, how can we learn from the past, bring it into modern times, and yeah, okay, modern medicine is incredible, and we're pushing that scene, but how do we amalgamate the two, right? And create some sort of rope-like structure where it all twists and combines together, you know, because we can't just bastardize modern medicine because we wouldn't be here now. You know, we'd still have all
Mm.
these diseases that we've now eradicated. But at the same time, I was like, well, if we're still practicing these things that we've been doing for thousands and thousands of years, then they must hold some sort of weight, you know. And I think if we just bastardize them and push them to the fringes and forget about them, then we really are kind of chopping off our leg to spite our foot, you know. And I think it's really important, mate. I think it really is. We bring it in, and I think, philosophize a lot more. You know, just ask those questions. Be curious. You know,
Mm.
what's it going to be like if we go one side and not the other? Okay, it's going to benefit this side and maybe not the other. Okay, sweet. What happens if we go both? What happens if we combine the two? You know, you see the same with psilocybin now with like mushrooms and the experimentation with like DMT and stuff like that, right? And I'm so fascinated because all these wickedly smart individuals, way smarter than I am, you know, are figuring this out. And I'm really glad that it's in your hands, not mine, because I'm that guy that likes to lift heavy things and be like, that was kind of heavy. Maybe I should do it again.
Mm.
Yeah, sounds good. You know, but the combination of all these things, how can we create a well-balanced human being? And how can we create a well-balanced life, right? To create progress, because that's all we're trying to do, help some people and create some progress. Because it seems like in the past 100, 150, 200 years where we've been beating the drum of industrial revolution, right? And we're trying to digitize everything and work, hustle, kill. You're like, great, but it seems like everybody is absolutely knackered. I was like, okay, well, how do we help each other?
Mm. Yeah, I think one of the words that I've really honed in on that you keep mentioning is kind of curiosity, and you know, in curiosity for me is one of the most dangerous, unattractive human traits. I think there could be, because curiosity for me is where life, thinking, creativity, and healing flourishes. And one of the things, I'm certainly a huge advocate of modern medicine, and I'm certainly not advocating that someone heals breast cancer with a couple of crystals and some chanting by any stretch of the imagination. But there is, there is absolutely hard evidence. If you kind of go back over the annals of time in science, the absence, or every theoretical approach always is just an approach. A hypothesis is supported and it's not proven, it needs refining, according to Bayes' kind of theorem. And then if you look at, just because there's an absence of evidence, as in there isn't some hard science to support something, doesn't mean that evidence is always going to be absent,
Mm.
because it hasn't necessarily been researched yet. So if you look at something like the efficacy of yoga as an intervention for post-traumatic stress disorder, yoga has now hit the threshold, and exceeded the threshold in terms of the evidence base for treatment of post-traumatic stress disorder and also depression as well, and has beat drugs such as Prozac in terms of improvement, where you would like to see clinically good outcomes for patients. It's crossed the hurdle in terms of randomized controlled trial studies. And so RCT is the kind of gold standard in science that we look for in terms of being able to demonstrate efficacy as a proven intervention or as an evidence-based intervention. So
Mhm.
we know that this shit works. So it's not as if this is hokum science anymore. And one of the things that I find sort of quite frustrating when I'm dealing with some medical practitioners is that they are incurious as to what the benefits of these alternative approaches might be. Whereas if you rewind 50 years ago and you were to go into your GP, and this is kind of before antidepressants were kind of widely prescribed, if you were to go into your GP 50 years ago and say to him or her, I'm feeling a bit down, I have a low mood, whatever it might be, I'm living with, fatigue, they would probably tell you to get off your ass and go for a fucking walk, because they knew back then that moving your body will help you. And it does. Being outdoors, connecting to nature, going for a walk can do huge amounts of benefits, or bring about huge amounts of benefits for you psychologically as well as physically. And this kind of concept that the mind and the body are somehow detached from each other and are separate entities, and not interconnected and fundamentally, intrinsically linked to each other, is hokum in itself. I don't understand how anybody can think that what we think and what we do with our bodies isn't linked. And I've certainly experienced that in my own recovery and experiences throughout my childhood. And then I managed to survive a very abusive childhood and marriage. And really what got me through it, apart from a lot of good therapy, was my beginning of my marathon running. That's actually what that acted as the catalyst for me to begin the journey into kind of being much more forward facing around my own personal trauma experiences.
Dude, again, I just want to say thank you for that honesty. And I also love you for saying the word catalyst, right? Because I think it's every single fucking day I say fitness is a catalyst to improve lives. I think we are the base level. We're kind of a little bit erratic, ADHD, definitely dyslexic, not the most smartest of individuals, but just bringing some people in the room and moving them around and like, cool, high five, piss off, see you tomorrow. But you're like, but that is the start. It's the start line. Like, okay, let's take one step forward. We've done that. We've ticked that box, and then people go into their everyday life, right? And they're like, oh, okay, cool. How much better can I feel if I work on all these other things, and not just fitness, not just yoga, not just, I don't know, bloody swim, acro aerobics, or whatever the fuck people want to do, right? It doesn't matter. Marathon running, lifting weights, stretching, doing something with a body. If I do something else attached to that, how much better can then I feel, and how much can I improve my life? What can I learn about myself and discover, so then we can understand the world around us and the people that we associate with the most a little bit more, right? And I think it's beautiful. I think we need to be encouraging people to move around. And unfortunately, with the old GP now prescribing pills, that it means profit margins. More pills means more profit. And okay, fine, we know that. We know everything has a level of corruption, including individuals. We have our own bias. Okay, we fucking know that because we're in ourselves and we know we're biased. Okay, we're not completely ignorant to our own limitations, right? You're like, sweet. So hear what they got to say and get a second of bloody opinion, and then go try out different ones. Oh, I feel like I'm really tired and lethargic when I'm taking Prozac just to pull one out of my ass. I don't know how many times you take it a day, but say twice a day, right? And you'll feel really tired and sleepy, and I need a nap in the middle of the day, and I feel like my charisma's gone down or whatever. Okay, cool. Stop that. Try something else. Try yoga. How do you feel? I feel good, but I feel like I got a little bit more energy. Great. Try some swimming. How do you like that? Marathon running. You like running? Great. Go for a friggin' run. And it's being able to understand the law of individuality, right? Of be like, okay, well, you're a friggin' individual. Figure out you, dude. Figure out who the fuck you are. And unfortunately, we don't like sitting with those emotions or or thoughts, and okay, yeah, what do you think? A pill? Sweet, give me that, and we've always going to have that little bitch voice in the back of your head that says, where's the easy option out? And that means just swallowing a pill, right? So my question to you would be, how the hell do we attack and overcome that bitch voice that everybody has? Everybody has. We're always looking for an easy out.
Mm.
Always.
Yeah, it's a really good question. So within mental health, we have there are organic disorders. I hate the word disorder, but that's what they're called. So for the sake of clarity and consistency, I'll just use the word that's used.
Sure.
So for instance, if we take bipolar as an example, bipolar is an organic genetic disorder, and we know that we've identified the subgenotype which bipolar is, and within the kind of classical definition of bipolar, there are three types: type 1, type 2, cytothymic. But actually, in reality, we know that when we look at the genetics of bipolar, there are over 30, I think it's 32 different subtypes of bipolar that exist. That, as a mental health disorder, needs to be treated with psychopharmacological interventions. Not always, it can be done in combination with things like meditation, yoga, exercise, and we know that those are very mediating factors when it comes to good clinical outcomes for individuals. So yes, they might need to take a mood stabilizer, they might need to take an antidepressant, but if they also combine that with, say, regular exercise, meditation, whatever it might be, mindfulness-based exercises, become more aware of their own thoughts, kind of what we call metacognition, if you like, then they might be able to reduce the medication that they take. There is also an issue which isn't commonly spoken about and isn't in kind of mainstream medicine, which is we now know if we do some effectively genetic testing, we can tell what people will be responsive to in terms of antidepressants. So you've probably heard lots and lots of stories about people taking antidepressants and they haven't had any effect, or quite the opposite. They've ended up gaining weight, but they ended up becoming more depressed. Well, that's because we actually, believe it or not, we have a predisposition to respond to certain medications and not respond to certain medications. Now that applies to antidepressants, psychopharmacological interventions, but it also applies to things like taking statins and things like that as well. So it's a really important test that one can do, and it's something that we do with our clients at the Beekeeper, because it saves a lot of time. If you have someone who has an organic disorder that needs an intervention of some type, then we can test what they will be receptive to in terms of treatment protocols. When it comes to other disorders, such as post-traumatic stress disorder, or something which manifests itself more physically, that's where, kind of, as I mentioned earlier, meditate, don't medicate. It's the role of a psychologist, or the role of a mental health practitioner, to try and explore all other options prior to kind of pressing the button on, or pressing the go button with medication. Or if you do use medication, then combine that with effective talk therapy as well as kind of the more physical mindfulness-based approaches that we've touched upon. I'm always very keen to advocate that there is a role for mood stabilizers, antidepressants, within the world of mental health, and we've made incredible advances, especially in recent years. However, that doesn't mean there aren't alternatives that shouldn't be explored at the same time. And I don't think it takes a terribly intelligent person to be able to realize that you should explore all different options. But with mental health, for some reason, it becomes very easy to try and prescribe your way out of a problem. And that is, I think that's a disservice to individuals. I think it also pathologizes individuals. I think it tells someone that they have a disease, because if you have a disease, you take medicine to fix that disease.
Yeah.
Well, depression, all of us will be depressed at some point. All of us will, the vast majority of people, I mean, I can't remember the exact stats on this, so bear with me. So in the DSM-5, which is the kind of Bible of mental health, not that I'm a big fan of it, but it, the worst form of trauma that you can experience is a criterion B trauma. So that would be witnessing a terrible car accident or something really horrific. Most people do not develop post-traumatic stress disorder,
Wow.
which is what's kind of inculcated into us nowadays. Most people develop something called post-traumatic optimism because they'll see something happen and go, fuck a tuck. I'm really lucky. Actually, I thought I didn't have my shit together, but actually I do have my shit together. Now, that's not to minimize the experience of those people who do go on to develop post-traumatic stress disorder in any way, shape, or form. But the reality is most people, I mean, I can't remember the stats, but I think it's something like 35% of Americans experience a criterion B type trauma. But most of them go on to develop a form of post-traumatic optimism, which is really interesting, and it kind of shifts the narrative away from pathologizing people and saying, if you experience traumatic, complex trauma, which is a series of traumatic events, or PTSD, which refers to one specific event, you don't have to go on to develop the symptomology of PTSD. You can end up actually coming out of it a much stronger person and an individual as well,
Wow.
without taking a pill.
Again, it's attacking it from an individual perspective, right? Rather than be like, oh, okay, you experienced this. This is what you got. Here you go. Here's the remedy. Piss off. Next person in, please. It's like, well, I've seen it firsthand of people been given a label, and whatever that label is, ADHD, depression, autism, whatever, right? And you see their behavior change. I've known you before you got that label, and I still know you now. And it's like, it's subconsciously you're playing into it. It's like, well, it might explain some things, but it doesn't mean you've got to buy now, guys. Like that's not the whole thing. It's being able to understand the cards that you're holding in your hand, right? And maybe become a little bit more skillful of playing them. It doesn't mean, oh, okay, I gotta buy through this round because I got shit cards in my hand. It's like, no, 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 because we're all individuals. We need to learn how to figure out ourselves and then communicate it and hold ourselves in certain situations, and we need to um be a little bit better of being like, oh, hey guys, I might be a little social anxious here, or my reading might not be great here, or I might not pick up on some sort of facial cues over there, and that's fine. But we can't play into that label. Now that's what I've seen a lot of the time. And it's
Mm,
that's again a difficult one to navigate because if they're believing, which we should do anyway, right? We should believe with some sort of weight what our medical professionals tell us because they've spent a shitload of time in tertiary education, and we should think that the people that we go to we trust, right? Okay, cool. If they've given us this label, they've given us this remedy, they've given us this solution, then that's it. And I'm like, kind of. We need some sort of strategy, right? Okay, cool. You got that pill. We're going to do that in the short term. How we end up going to reduce that? How we're going to pair it with some other stuff like you were talking about, meditation rather than medication, right? Are you going to do some yoga with it?
mm,
Are you going to go for a run with it? Are you going to talk to some peeps with it? Are you going to do some bloody painting with it? Like whatever. How are we going to then wean and where's the progress? It's like, no, this is where I am. This is the hill I'm going to die upon. Like, guys, we've got to change.
yeah, and I think sometimes there can be something even more insidious than that. And I think this is something which we don't speak about a great deal. And I've certainly seen it specifically amongst some younger people more recently. Not that this is kind of, this isn't that objective, but I think if you pathologize someone, so that someone's feeling anxiety, like anxiety is something that exists in life. It's not something that we can escape from,
Mhm.
and it will always exist. But if you then say to someone, well, you have a social anxiety disorder, or you have a generalized anxiety disorder, or you have one of the panic disorders, or whatever it might be, and you give them that label, what you're also doing is you're beginning to chip away at that individual's resilience
Mm.
and their ability to be resilient to the shock factors that exist in life and will always exist in life, and there's very little that we can do about it, because life unfortunately will throw you some curveballs, and it will just be shit occasionally. And you or no one, a parent, can't take that away from an individual. And when you give someone a label, whatever that label might be, but especially if you're looking around commonly felt issues such as low mood, depression, etc., when you give someone that label, what does it do to their resilience to those issues? If you give them a pill, if you pathologize them and you put them into a little compartment and said, that's you, you're depressed, that's the label you have, good luck, here's a pill. What does that do? What does that do for them moving forwards into their lives? Are they actually tackling the crux of the issue? Are you impacting negatively their resilience as a human being and their ability to chart their way through and navigate their way through life effectively? And I would often advocate that one of the reasons why talk therapy, effective talk therapy, is so important, because one of the things that we look at very closely is an individual's resiliency to the factors that impact us during the course of living, during the course
Mm.
of life, because shit does happen. And resiliency is a really key part of our development as individuals.
1000%. I couldn't agree more on that. And they are fascinating questions to ask, right? I think the impact, the whys, what's next. The I think it's what we need to ask ourselves, and then also we need those people around us that are going to ask us as well, right? Those that tight knit group. It's like, oh, are you sure you should do that? Yeah, why? Yeah, but what's next? What's after that spot? You're like, oh, I wasn't really thinking. I was like, yeah, I think you should fucking start thinking. You need those people to just slap you in line sometimes, and I think that's a fascinating way of going about it. Dude, I've got three
Yeah,
questions.
sure, go for it.
What's the greatest piece of life advice you've ever received?
Manage your own PR.
Hmm.
Yeah. Best piece of advice I was ever given, and that was in a professional context. I think it was a nice way of the guy saying you're being a bit of a dick, and you need to think about the way that you're presenting yourself within the company that you work in, but you need to manage your own PR more effectively. It was a
Hmm.
very nice way of saying, and actually, when you look at it, it is true. You need to think about the way that you present yourself to your colleagues. Internally, we always think about the PR of a company, how the company is presented, but you also need to think about your own PR amongst the way that you communicate with especially your professional networks.
I like that a lot. Humility, right? We need to give ourselves some humility and a little bit of self-reflection.
Yeah,
Sometimes,
absolutely.
say, hey guys, sorry, I fucked up. Seems like that sentence comes out of my mouth more times than not. But anyway,
Yeah,
what's the
true.
uh what's the worst piece of life advice you've ever received?
Oh, I feel terrible for saying this, but and I love my father, and I have a great relationship with him. But he was in the forces, and he is absolutely supreme at giving me some shocking advice. The worst advice he ever gave me when I set my first company up was, what you must do is you must prioritize paying yourself, which obviously is actually the thing that you least prioritize when you first set up a company is taking money out of the company to pay yourself. Obviously my first company went bankrupt almost immediately. So that was the shittest advice I was ever given. But he wouldn't know that because he's been effectively a civil servant because he's in the military. He doesn't understand that money doesn't grow on trees. You have to actually create it.
Yeah. Yeah. When you've always had a salary, right, and been employed, it's a
Yeah.
little bit different when you come into that self-employed private sector.
Oh, he carries on giving it to me, man. The other day, because I'm the CEO of a group of companies, I was having a really rough couple of weeks because I'd had to let some people go, and so I called my dad, and I just wanted, a little bit of support. And he was like, "Nobody likes the captain of the ship." And I was like, "Cheers, Dad. No, I feel so much better now that I've had that. Great. Cheers." But yeah, apart from that, he's a fantastic father. And the shit advice actually is quite welcome now because I always know it's going to be crap. So
Mm. And it offers a different perspective, There's some beauty in that.
yeah, exactly.
All right. What are the 3 words you tell your younger self?
The 3 words I would tell my younger self. Ooh. I mean, I think the most powerful words in the English language are "I don't know."
Oh, that is beautiful.
There's great power in not knowing the answer to a question and being able to express it and just say, I don't know. I wish I'd had the ability to say those words a lot more when I was younger. And I revel in mediocrity. I love the fact that I know that I'm shit at the vast majority of activities that I engage in. It
Mm.
just so happens I'm quite good at a couple of things, and being able to turn around to someone and say, I don't know, or is incredibly powerful, and it's also a life skill because it speaks to ego. It
Yeah.
speaks to so many different aspects of one's individual existence. And when I was younger, I always had to know the answer. I always had to know the answer, or thought I knew the answer more accurately, and often I didn't have a fucking clue what I was talking about.
I don't think anyone does, brother.
No, we're all just winging it, which is fine.
Dude, this has been an honor and privilege, man. Like, thank you so much for your time. Thank you so much for your expertise. And let's do this again sometime.
Absolute pleasure. Good to meet you, and I look forward to chatting with you again soon. Let's stay in touch over email.
Yes, sir. All right. Travel safe. Enjoy your holiday.
All right.
And we'll speak soon.
Take care of yourself. All
Take
right.
it easy, man. Bye,
Bye.
everybody.